Hi, a bit later than advertised. Well, actually, oh God, is it 7:30? Sorry about that. I am a bit later because I've been in the OR, in the operating room, or operating theatre, as we call it in the UK, and I realised that my battery was running low. If you really must know why I'm doing this in my car, because I know it looks so much better in the operating room. With the backdrop of theatres, and I know it looks a lot better, and it looks a bit rubbish in my car, but my battery was running low, so I've had to do my post-op rounds and come and charge up my phone in the car, and I'm just hoping to goodness my radio doesn't click in like it did last time. So we've got questions today revolving around what were the questions again? There was something about what to expect after inverted nipples, how soon after surgery can I have, after consultation can I have my surgery, and I don't know how I can find what the other question. There was another question, wasn't there? Anyway, okay. Oh, how soon I can fly and how soon I can have surgery. I think those are the three questions. Right. Okay. Sorry, I'm just trying to go closer to the building. I'm driving now. I feel like I'm on top gear. Am I back? I'm back. Sorry. Right, I better turn the car off. Oh, I better put it in park. Oh dear, I'm not in top gear, am I? Right. Yeah. Sorry, this is a problem. I should have done it in theatres. Is the picture funny? Anyway, so right. I'm going to answer those questions right now. Question one, what to expect after inverted nipple correction. Now, the whole thing about inverted nipple correction is that it's a really tiny little incision. There's a tiny little stab incision at the base of the nipple. And the best way to evert the nipple is to cut the milk ducts. Because personally I make a very small incision, which means a lot of the surgery is what we call blind, i.e. you're not having direct vision of what you're cutting. And you get bleeding, because I know, the reason I'm making a point of this, because I know where this question is leading, because you get so therefore you get bleeding when you cut those ducts, and you do have a bipolar, a little machine to stop the bleeding, but it is difficult to stop all the blood vessels when you're doing the inverted nipple correction, and so therefore you do tend to get a lot of bruising, and I think that's why this question has been asked, because I think Fiona's had surgery on Friday and is now, I think she's very bruised, and that's why. So you often actually are quite bruised after inverted nipple correction. The plus side is that there's incisions very small. The downside is you get a lot of bruising. So that's why you get the bruising. Just in general, what to expect after surgery. So the surgery is done under a local anaesthetic, which means you stay awake. It's done in the clinic. Do it on a see and treat basis, so people can come and have it done, and on the same day as the consultation. We do free consultations for that, and go to the new job. And they have it done on local anaesthetic. Then you go home, and then waterproof dressing, so you can shower and things like that with the dressing. Dressing comes off after a week, and then you don't need any dressing after that. But you are a bit battered and bruised for a week or two, and a bit swollen, and there's a bit pinched in. When you do an inverted nipple correction, you put these sutures underneath the nipple to help keep the nipple up, and that means that it does look a bit pinched and a little bit strange, to be fair. The nipple does look a bit strange for a couple of months, and then the sutures that make the nipple look strange are dissolvable, so then they dissolve, and then that's all fine after a couple of months. So that's what you can expect after inverted nipple correction. How soon can I have surgery after my consultation? Well, as a member of BARPS, there is a guideline that says you need to wait at least 2 weeks after having the consultation prior to surgery, and it also depends on the waiting list. There's usually a month or two is sort of usual, I guess, between having surgery and having consultation and having surgery. But it's good to spend some time considering things. It's a bit like when you buy a credit card. You've got to have that 2-week cooling off period just so you can consider everything. I understand that sometimes people, if they've seen lots of doctors before, they've got a good idea of what they're having done, then they might say, look, I want to get it done as soon as possible. So as soon as possible is 2 weeks, assuming that we've got theatre slots. If we haven't got theatre slots, the normal time for waiting, the normal waiting time, as it is often known, is a couple of months for surgery. But we'll always try and accommodate people as much as we can. So we'll try and give you the date that you want if we can. Question 2 that was. So question 3 is flying. Did I do flying last week? Or did I do one last week? Anyway, was it half? Anyway, flying. We asked the question, so it shall be answered. Yes, if you can fly pretty much straight away. This is what we want. And a question live. That's what it's all about. Thanks, Amy. We've got a live question. Don't make it quick, Amy. Let's have a live question, and I'm gonna answer that question, Amy. So the flying answer is that you can fly pretty much, a week after surgery, but it's usually best to wait until everything's nicely healed, because you don't want to get infection or anything when you're abroad. And also, certainly if you're going flying for a nice thing, if you're going on holiday, then you don't want to be uncomfortable. So I'd say a couple of months would be reasonable, because you probably will be a bit uncomfortable to start with. So yeah, a couple of months is reasonable, but if you really have to fly, then you can fly. Dawn, good to see you here. We can do a virtual consultation. I'm going to see you tomorrow. Good, and I'll see you tomorrow, Dawn. Glad you're well. Just have a relax and have a relaxing day. Amy, I'll make it quick. I've made the rice sizes in 400 to get an idea of size and wore them in a few bras, but think I would like to go a bit bigger, maybe to 450. Could you have a look at the sizes for me and let me know if I could have any bigger in high profile, or if I have to go to the extra high profile in 485 if I want to go bigger? Thank you. Yes, I will do that, Amy, and I will let you know. I'm not a massive, great, big fan of the size, the rice size thing, because, and you obviously know what you're on about, because you're talking profiles, because you know that's important. The profile's really important, because people take the time with the sizes and they don't take the rice size that doesn't take into account the profile. So the profile's really important, but I will definitely have a look for you, Amy, to see if you can go. I'd like to go bigger to 450. See if you can go 450 in a high profile, because that is the question that's there. Can I go 450 in a high profile? People say, oh, well, I want to go 450 cc's. I'm always like, well, there's loads of 450 cc implants. You've got to look at the profile. So obviously you've been to clinic, Amy, so you know these things already. But that is why the rice test is not, in my view, a good thing to do, because it doesn't talk about the profile. So I will definitely have a look to see if 450 in a high profile is reasonable for you, and it's all about the width. And if it is, then fine. But as you say, if not, you might have to go to a 40 or whatever. I don't know. You're saying the numbers there. I'm not sure what the numbers are, but you might have to go to an extra high profile. But I will look at that, and I will Facebook you back or email you or something about that. And Dawn, I'll see you tomorrow. And this is what we want: some live interaction on the Facebook. So I think I've answered all three prior questions, as well as the live questions that came in. As ever, any questions, please do email them to us, or Facebook me them, or Twitter me them, or do whatever you want, Instagram me them, whatever you want. I'll be very happy to go through those next week, when we will do the same thing. Same time, same place. Well, hopefully not the same place, because the cars, I'm aware, it does look a bit a rubbish backdrop. So I'll see you next week. Or in fact, Dawn, I will see you tomorrow. Bye.